Hi, everybody. Happy Wednesday. We are joining you for coronavirus inside the Arizona numbers, where we break down the data that's coming from the state and the county and help you better understand what it all means. And we're not here to make choices for your life, as I always say. We're here to guide you through the numbers so that you can make the best choices, knowing your family and your family's health. We're just here to help you through that. So let us know in the comments, as always, if there's a number we can help you find, and we're happy to do that. In the meantime, I'm Katie Ramel here at the station today. You can see, as I show you on Wednesdays, empty here behind me, just a couple people as we socially distance and are here at the station. Garrett's at home once again today, and Garrett, let's get right into Corey's writing. You guys switch places just on Wednesdays. Corey, you're very observant. Thank you for the comment already. Let us know where you're watching from. Obviously, as Garrett's pulling up the Arizona numbers, I like to remind everybody that we are diving into Arizona-based numbers, but I've heard from so many of you from other places outside of Arizona who are using this information to then go look up the numbers in your state, in your region, to help you better understand what's happening there. So let's get right into the numbers today, Garrett.
All right. So we have, we're starting out at the azdhs.gov, as we always do, and we're going to start out at the summary page. So here we are, total 168,273,000 cases for the state. That's a death total so far today of 334.54. That is the total for the state. New cases reported today, 2339 new cases off of 10,499 PCR diagnostic tests and 2382 serology tests. That's, as you can see, the percent positives for the diagnostic has remained the same at 14.6, the serology at 4.9 today, basically equal to what we were yesterday. So what that means is, again, today we have very low percent positives. The estimates that I have for percent positives today, if you just give me 1 second, the estimates are 22.3% is our estimated percent positive for the PCRs. The estimate for the total is 18.2 today, so under 20. And then for the PCRs that don't, for the labs that only report, and for the ones that we know that we can verify, essentially, that's still going to be under 14.6% today. So mostly the Sonora Quest labs still under 14.6% as a daily percent positive.
So let's talk about Sonora Quest. The test results that we got in today, back up to 12,000, hoping to see even more than that, maybe even closer to 15,000 as we try to work through these numbers. As we've mentioned to people, especially those who are not watching from Arizona, there is a backlog in test results coming out from one of our main providers, which is called Sonora Quest. And Garrett, are you able to see the numbers today to see how they're making their way through it? We were at 62,000 cases that were sitting out there waiting to be processed, and each day we're walking you through how we're making our way through the numbers. But do we have an update on where we stand in that today?
We do not have an update from them. I just checked prior to coming here if Sonora Quest had released a new dashboard, and they did not. So they still have the 39,000. What I do have, and I'm just going to stop sharing this really quick and share something else. This is the closest I can come to guess what's going on here. We could see our case lag today is 14 days. This is what the actual epicurve looks like. Light blue was added in today. Dark blue was there yesterday. And we can see that the 7-day average says, oh, we are now going to stop the 7-day average at when basically the lines go in stable. So what that means, and what we see here, is the cases added today for 3 weeks ago, 1,009, 637 from the week prior. Those are likely backlogged cases. So they probably did a substantial number of cases, but we just don't have an update from them today.
Okay, so as we have a lot of new faces and new names joining us on here today, I want to explain the epicurve that you were just showing a bit more. The yellow line is basically smoothing out those numbers so that we can kind of see the trends and changes in that. And the yellow line ends where we can stop trusting the data at that point because it's not updated.
Correct. So the yellow line is, the yellow line is programmed to stop when the curve becomes unstable. So as you can see, it stops right there when you start seeing light blue being added at larger time. You'll see there's a little bit of light blue up there, so there can be light blue prior to the the average stopping, but it will stop when a substantial amount of light blue starts to show up. And this is how we're detecting the case lag. As we get through the case lag, that 7-day average will start to creep forward to what, and we've told you before, a 7-day lag. We are always going to assign it a 7-day lag no matter what. So if we ever get to 7 days, that means that we are technically caught up. So at this point, we're not caught up yet. Sonora Quest said that they'll have everything processed by the 31st, or at least that's what they told the AZDHS. Mm-hmm. It is the 29th, so we have 2 days to see if they're going to do that. We shall see.
Yeah. So how many days back is that yellow line at this point?
It is 15 days back.
Okay. And we always highlight for all of you on here so you can get a better idea of how far back you can trust those numbers, because some people were sharing a similar graph to this, or any of the graphs that start this steep downward trend, and citing it as what's solid up to this moment, but that's not the case. So we want to,
as you can see, the cases from, you can obviously see these are week blocks. So 1, 2, 3. So the cases from about 3 to 4 weeks ago, they've stabilized. So the downward trend that the 7-day average is showing is now, even with the backlogs that have been filled in there, has been firmed out to being a downward trend. So we no longer have to say, oh, we're waiting to see if we're going to have a downward trend. We do, in fact, have a downward trend on cases, and that same thing on tests. As you can see, the test numbers have also gone down. We really wish they didn't. We want to see more testing, but as people pointed out, we pointed out last week, some of the testing demand has also gone down too. So, like those lines that used to have 8 to 15 hour waits, there was nobody in line a couple weeks ago. So, we can only test as much as people want the test. So we can also expect to have some decline in these testing numbers as demand goes down.
Yeah, if you are looking for a test, we should say on here, go to the Arizona Department of Health website, and they've got a link to both the saliva tests and some of the traditional tests that you've seen that are going up the nose. So you can sign up for either of those. I shared yesterday that I went and took a saliva test. It was so easy to do. It was one of the drive-through tests, and it's a free test. You just have to be sure to register before you head over there. So you can find that information on the Arizona Department of Health's website. One of the other things, some of you were just listening to the county on Facebook Live here on ABC 15 just a few minutes ago, and they were talking all things data, which Garrett and I can very much appreciate. But I also like that they were working to dispel some of the myths, and there's some of the same things that we've been talking about on here when we get questions about this. And one of the things they talked about was the difference in some of the numbers that we'll see, and we've talked about this, Garrett, when you look at the state website versus when you look at the county website. They wanted to remind folks that these are electronic data polls. And so if you pull the data just a few minutes apart, you can see some different numbers. So it doesn't mean that things are off. It just means that one might have a data poll at 9 a.m. and one might have a data poll at 10 a.m. And so that's the difference that you see in those numbers.
Yeah, this is a live database. I mean, when I worked at the Secretary of State's office in voter registration, it's the same exact thing. These are live databases that are being updated, and the transactions are occurring in real time. So as you said, if you push the query button and say, okay, I need a report of X, Y, and Z, and someone else pushes the query button 10 minutes later, the numbers are potentially different. Now, with COVID-19 being as moving, as fast as it is, I can see that there's definitely going to be a larger disparate number in how those are reported. So, and it's also a function of, each county health department and the state health department have their own EPIs working on this data. So each one is producing their own investigation. So sometimes you'll have situations in which the death number at Maricopa County doesn't match by, it could be as high as 100 or so. The death number may not match the state number. That doesn't mean they're not going to reconcile. It just means that at this very moment they're out of sync, and they will eventually sort of come together. But this is an investigative process, and I think people, myself included, we're so used to getting data in real time. That is both the best and truest form. We don't realize that when this is an investigative process behind it, that there's going to be some pullbacks. In fact, we had a pullback of a death today. We talked about this on Sunday, how we had -1 deaths on Monday. But But we had a pullback today in Santa Cruz, but because Maricopa County did its normal report, it was obscured by the simple fact that Maricopa reported. Had Maricopa not reported, we would have seen another -1, a death pullback. It does occur. It's actually not an uncommon occurrence that deaths get pulled back because they have to do more investigation on it.
Yeah, and the chances of seeing that really only happen on a Monday when the numbers are so low. We did pass a milestone in the U.S. today that I just want to touch on and highlight. 150,000 Americans have now lost their life to this. And when we talk about these numbers, we know that they're numbers and we're diving into the data, but we also always remember that there are real American families behind these numbers who are in the hurt of their lives right now as they mourn the loss of their friends and family. So the fact that we passed that milestone today, 150,000 American families dealing with this right now. So some of the other numbers that we always like to look at on here are the hospitalizations, and it was sort of a mixed bag in the numbers today. Some up, some down. I saw from your Twitter account where you sort of break down the numbers for us. If any of you want to follow Garrett on Twitter in the mornings, he quickly, well, I shouldn't say quickly. You quickly post it, but you spend a lot of time looking at it at Garrett_Archer to give us kind of a snapshot both of hospitalizations and a closer look at that summary page that we always show you on Arizona Department of Health's website.
Yes. So yeah, let's go through the hospitalizations. As you said, mixed bag today, but nothing out of the ordinary, if you will. I mean, you're going to have some movement in hospital bed counts. No trends have been established yet. We'll start with hospital bed availability. Once again, this is COVID agnostic. This is just beds, a bed count that is done every day by all the hospital systems that then gets put on the AZDHS's website. This does not. It does not matter about COVID-19 or not for this count. So you can see some slight increases in ICU, 85%. This was 84% yesterday. You can see emergency room visits. This one you can see is slightly noisier. It's slightly up, but again, it's a noisy data set. And inpatient, which is just general acute care beds, anything that they can put a patient in that isn't an ICU or a maternity bed, essentially, that is also up. So we had the general census numbers did mostly go up today, also in ventilators. Now we go back to the COVID-specific metrics. We can see that there still is an established trend, a downward trend for most of the COVID-19 specific metrics. So from 2564 to 2424 in the inpatient numbers. On the ventilators, it went from 574 to 561. For the ICU, a small decrease, 814 to 800. In the discharges, an increase, 368, but you can see that the trend, you really want to look at this one by week, and the trend is that these are going down as there's less COVID-19 patients in the hospital. COVID-19 emergency room visits, that has gone up just a tick. It looks like it's a little under 100. That's, like I said, you've seen that there are other upward motions here. This is a noisier data set, so I presume that this trend is still going to maintain itself. Although we do want to watch this one. This is probably the best leading indicator we have for what's going on out in the community. Since we don't have really good contract tracing and it's difficult to make any decisions on the cases. So the emergency room visits, this is a good leading indicator. If this starts to go up again, then that's sort of the canary in the coal mine, if you will. That's like, oh, something might be going on if we're starting to see more emergency room visits. In intubations, down from 92 to 87.
All right, Garrett, I want to answer some of the questions that are coming in, and we're seeing a lot of comments back and forth. You all are having conversations on here, which is absolutely fine. But if there's any question you want us to show you or answer for you and show you where to find it so that you can look it up each day or whenever you like, we're happy to do that as well. And Vicky writes just a moment ago, let me scroll back here to her question. Sorry. Let's see. Vicky with an I, where'd you go? Vicky Jones, there you are, my dear. Anywhere we can find the number of children's deaths for AZ and for the US. So Vicky, the way that Arizona breaks it down is age 20 and under. We don't get the specific ages of the children who have died, but we can tell you, didn't we just lose another person under 20 that was just reported in?
Yes, we did have one more death today for someone under 20. So I will share that screen. Again, we're going to stick with the AZDHS for this because this is where the age categories are. So this is sort of where you can see what the deaths are looking like. We have under 20. That's the best we have for kids. And that was 11 yesterday. It's now 12. As you can see, the percent of deaths, it's still under 1%, well under 1%. With, and this is where you'd sort of look to see what those age groups look like.
Yeah, so Vicki, this is on the Arizona Department of Health's website, and you can actually get that closer look at it. As far as kids who have the virus, are we still right around 20,000?
I would presume so. Let's see.
So
We're going to go. This is demographics for everyone who's watching, and yeah, we're about 20,000, 12% of cases. If I remember today, there was a slight increase in that, so that age category did have the highest increase of cases of all the other ages today. Not significantly higher than the other age categories, but it did beat out the other age categories for the number of cases today.
Yeah, Caprice is writing 12 too many. Absolutely, Caprice. And I know we're going to get asked about the kids a lot because I know a lot of you joining us on here are parents or grandparents. And as we saw in Vicki's profile picture there, that cute little one cuddled up next to her. So I know that you all have a lot of concerns about sending your kids back to school. So we can help you find the information that you want to track. For those of you who are not in Arizona, we're waiting for metrics for how to judge whether the school districts will open back up. And as soon as we get those, I know a lot of people are going to be asking for that information, and we'll help you track that right here as we do each and every day. But for now, we'll be sure to highlight that section on the kids every single day, so we can help you find it on there. Vicki's writing, thank you very much, Vicki. This is why we're doing this. We're happy to help you find this stuff. Garrett and I stare at these charts and websites and numbers and graphs every single day, so we can find it quicker for you, and we're happy to help you do that. One of the questions that we just got from the county, Garrett, or is being asked to the county, it was being asked to us as well, is if people were getting a phone call about testing positive. So if you get a phone call and you hear that you have tested positive and you haven't been there to take a test, a phone number could have been entered incorrectly. So they want you to call your provider. There's not many cases of this happening, but when you're typing your phone number in, which you do when you're setting up for your test, you could have a typo and put in the wrong number and somebody else gets called. So you should call your provider for the correct information. If that is happening out there, that's why there are two places that could happen: when you input your phone number wrong, or when some sort of data entry is being transferred by a human and they type it in wrong. So that doesn't mean that you're counted. Just because you got that phone call and because that might be happening, it does not mean that they're counting you based on that cell phone number that you put in. You're counted based on your date of birth and your name. So those are exclusive from the phone number. That is not part of the numbers that are being counted. So that can help clear up some of that conversation and concern that was out there, and hopefully help everybody kind of get a handle on that. So that conversation was just brought up from the county, and they wanted us to pass that along and stress that to you. I see some of the other comments coming in, and I know you're watching them too, Garrett. Were there any that you wanted to quickly talk about before we move on to the next thing?
I did see there was somebody who said something about comorbidities, and while the AZDHS does not give us any information on comorbidities, we can sort of derive some information on that using the Maricopa County data, which I'm sharing my screen for that as well. So when you're here, this is the Maricopa County data, and we can go here to view additional information. Oh, sorry about that. I have to reshare. 1 second. I forgot that it opens up a new tab.
That's okay.
So this is the dashboard for Maricopa County, and here we can see if we go to risk factors, this is where we can sort of see the deaths and comorbidities. So and we need to again have you imagine that there's a line between these data points right here. So what this is telling you is that in Maricopa County, 50% of COVID-19 deaths have come with people who had a chronic medical condition, and the highest risk group. So 85% of deaths in Maricopa County have either had a chronic medical condition or were 65 and up. So that's sort of the best numbers we have. As far as you can see in Maricopa County, 0% deaths 0-19, 6% for 2044, 19% 45 to 64, and then 65 plus is 75%.
Garrett, thank you. Jen Castillo writes a question from Spokane. First of all, Jen, Thank you for joining us on here. I really want to get to Jen's question because Jen has messaged me and let me know that she watches us from Spokane, and she takes this information and applies it to the information coming out of Washington State. And she sent me a special note on this. So Jen, first of all, before we get to your question, thank you for joining us on here. Your note meant a lot to me, and I shared it with Garrett as well. But she's asking, are people running out of sick leave while waiting for test results? I've been tested once, and it didn't take long to get the result, but I know several people who haven't been as fortunate, and people said they can't afford to miss work. So in Arizona, yes, people are waiting for these test numbers for way too long. And this is one of the things they're hoping to correct. So if you're looking for a test, I've been telling people the saliva test comes back within about 36 hours. I'll say that mine was at the very end of 48 hours, but 36 hours is kind of the general time frame. And as we talked about a little bit earlier, they're working to get those tests processed so that people don't have to wait this long, because Jen, that's absolutely a problem that people could run into here. All right. Yeah.
I did see someone ask questions. I saw someone make a comment about hospitalizations in Maricopa County going up. So I do want to address this because it's sort of a thing that just occurred over the last couple of days. Because yes, there it is. Thank you. This 1,308 and then 538 over the last couple of days. So what has happened? And I've got my screen shared so that you can see this. We found out yesterday. Maricopa County has put this on there, but this applies to everywhere. Hospitals are now required to report COVID-19 cases directly to the state for this process of filling in the hospitalization curve. So we need to make a very distinct difference here on this hospitalization curve and the hospitalization data that I showed you in the beginning. The hospitalization data in the beginning are bed counts from hospital systems. That is how that data is reported to the AZDHS. That is not case data. That is hospital bed counts, or in the case of emergency room, that is emergency room counts that they say are either probable or positive COVID-19. This is the sort of these epicurve numbers are the cases themselves. So this is the stuff where you have teams of epidemiologists working on data sets to verify these people are in the hospital, have COVID-19. This data was just recently added to the requirements for hospitals to report. So now the AZDHS and Maricopa County are seeing what's called the line data. So they're seeing the case data live every day, so they're able to catch up with this curve a lot faster. So the last couple of days, we've seen an increase of about 20, 30, I think it's 30% increase in hospitalizations reported on this curve alone, which sound alarming, but you need to understand that there is a very specific data processing break that happens right here, that it's going to take a couple weeks for it to fill in. So you see that obviously this one's actually a little better. The AZDHS one, which I'll bring up right now, is much more stark. And if you look at it, and we talked about this a little bit yesterday, how the number looks a little, it looks strange. You can see that all of a sudden, right here on July 9th, the hospitalizations just shoot up. It's like they go up like a rocket ship to July 13th. Well, that's because the EPIs have not filled in this data yet with this new line data they have. And it's going to take them a little longer because the line data they have is for current hospitalizations. So when you look at this, when you say, oh, Maricopa County shot up in hospitalizations, that's not necessarily the case at all. It's just that the data, they're doing a better job filling in the data for the more recent weeks.
Okay. Diane has asked us just a few minutes ago about getting to the RT or the R naught number. And let me go back. It's not her last comment. It was one at 2:16 p.m. for producer Cortland, so he can pull that up for us. Diane writes, why are you not talking about AZ being near the bottom with regard to the spread? So she's talking about R naught, and we can take you to that page. And the good news is, yes, we are at that point. We want to trust it more when we get these cases processed. So we're hopeful to get these other cases in by Friday so that we can really trust this good number that's coming out. But we are below 1. But one thing to note, Diane, is that whole bar range there. We could be anywhere within that. There's a high degree of confidence that we're actually at. What are we at today? 90?
We are 0.9. That's where we're at. You can see
we want to be below 1.
Yeah, we're supposed to be below 1. We have gone down all week. You see our range here is 0.68 to 1.06. Technically, with the range accounted for, we actually have the lowest R naught in the country right now. As you can see, Maine's lower end of their error bar is 0.7, and ours is 0.68. So near. Ours is a little lower as far as the error bars. But again, as you were saying, Katie, and always take these things into consideration, because while these estimates are good, at least they are, the intent of these estimates are good. It's always important to note that because we have the testing backlog, we still have to wait for that testing backlog to be fully cleared before we can look at this number and say, we just have a higher degree of confidence that this number is correct. The aggregators, the people that are putting this together, they can only rely on what data is being reported by the AZDHS on a daily basis. They can't factor in the calculation backlog of 60,000 cases. They can't do that. So we just have to look at this and say, okay, great data, great, this is great news, but just understand that until the backlog is completely processed, we're still sort of in this holding pattern of, is this true or not?
Yeah. So Diane writes, thank you. Diane, you're welcome. So to summarize there, we want to celebrate. We've got the celebration ready, but we'll wait as soon as these final case results come in, and then hopefully we have some good news and all that. Hopefully that number holds. Wouldn't that be awesome? Obviously, this is all about the spread, and we want to keep people safe. One other thing to note, that this is related to those results, not to deaths, not to hospitalization. So to this particular number, the outcome, if you will, doesn't matter. It's the test results that matter in all of this. So Trish writes, yeah, the backlog is still at least 3 weeks back. It's a huge backlog, but we hope that they'll have it finished by Friday, Trish. So fingers crossed. That was the hope in all of this, and the promise that they made. Some other questions coming in. I have to scroll back. Judy missed, what's the current backlog? Judy, they didn't publish the exact number today. As soon as we know how many they made it through, but we did have 12,000 results that came in. We'd love to have it closer to 15,000, but 12,000 test results came in today.
Yeah, it still has. I'm checking right now just in case, and it is still yesterday's dashboard. It still says 40,000. We did process, what did I say, 10,000 tests today?
12,880 today.
Yeah, and with test demand going down, we did see that there was at least a considerable amount of cases added to the curve from about 3 weeks ago. So while they're not working through it, they're not, we haven't had a 20, 30,000 test day. We had a 20,000 day a couple days ago, but they're still working through it, but it's just a process. So hopefully, fingers crossed, we'll have some really big test report days tomorrow.
Yeah, that would be really good news. Let's see. Another question just came in, and some of you are asking, Cindy with an I for producer Cortland, why not talk about why some doctors won't prescribe hydroxychloroquine? It's working. Well, Cindy, we're not here to talk about cures. That's not what Garrett and I, we are not doctors. We are not here to talk about how to treat a patient at all. We are simply, Garrett is a data analyst and he looks at these numbers all the time. I just love numbers and happen to go into a field of words instead of numbers, but really appreciate tracking this stuff and appreciate what data can teach us, that there is a progression in the numbers and things change all the time. And it's imperfect, but it's the best thing we got for making the best decisions about our lives. So we're not here to talk about those kinds of things. So we want to clear that up right away. That is not our area and our field of expertise at all. Let's see. What other numbers did you see today that were pretty interesting in all of this, Garrett? I should mention too, the other question we get a lot, these are deduplicated numbers. And as I talked about before, your record is created after you go get tested based on your name and your date of birth, just as it would be at a doctor's office. That's something, Garrett, we've talked about before, same sort of record creating system, and you're deduplicated. So once you have a positive case, you're not going to be counted several times over and over. So hopefully that clears up some of the confusion as well. What other numbers did you see, Garrett, today?
We can go over the projections from MIT. Where nothing, there hasn't been a lot of changes, but it's still worth going over because we still, at least according to this, are at the we're on our downward trend, and this has been a fairly accurate model. And so I do rely on this. As you can see, they have our R naught estimate at 0.91 right now, so it's almost at the R naught estimate of the RT Live. And obviously, there's slightly different methodologies for everybody. So we just want to. That's why they have the error bars. And we can see right here today, this modeling believes that newly infected 17,700 or so in Arizona. It believes that currently infected, so this is active infections, regardless of if they are counted as a case or not, 300,000 today, they believe is our active infection rate. And then right here, they believe about 1.5 million people in Arizona have been infected for this entire process.
This is important too for a lot of folks who want to scrub that bar forward to the date that their child or grandchild could be heading back to school. A lot of people are being told, okay, if you choose to stay home, we need a decision about coming back after Labor Day or a decision about coming back after fall break. So you're able to move that bar ahead and sort of get some really educated predictions on how things will look here in Arizona at those dates. So how do things look deeper into September?
Well, let's see. We'll go to September 1st right now. We're going to start with active infections because I think in many ways that's the most important number to consider for what schools look like. So it believes that on September 1st, active infections in Arizona is going to be a range between 265,000 to 56,000 people. That's 151,000, which is sort of the mean of those two, where they're saying we believe that 151,000 people in Arizona will have an active infection at that point.
Yeah.
And as you can see, it is as of right now, we're still going down. The curve has not moved forward. They expect that number to continue to decrease over all the way as far as these go out to November 1st right now, and it has us at 46,766 on November 1st. Again, as active infections. This is not, this is how many people have all had COVID. No, this is people who are walking around and would be able to transmit the virus. That number of who has had COVID, this believes it's going to be about 2.17 million people in Arizona.
Carol writes, please just do not live in fear. Be concerned, but please do not allow fear to take over your life. Carol, some really good advice for everyone. And that's why we are on here every single day to help everybody understand the numbers so that you don't live in fear, but that you understand what these numbers mean and you can make the appropriate choices for your life and your family. So Carol, thank you for saying that. That's exactly why we're here every single day. We're not here to decide for you. We're here to show you where to find this stuff and make sense of this stuff so that you can make the best choice for your life, or sending your kids back to school, or heading to the gym once they open again, or going out to dinner with friends and family. You know your own health best and you know your own situation best. We're just here to help you find this information. Let's see some of the other questions we just got. Trish asks a really good question, Garrett. I'm so glad you asked this. I'm gonna pronounce your full name wrong. Trishana, I hope I'm saying that right. She asks, how far off are we from the 28-day consistent decline recommended for open schools? So the White House gating criteria that came, this is what they want for schools: widespread access to testing, faster turnaround for test results, statewide tests below 5%, and this is the one she's asking about, the last one here, downward cases for 28 consistent days. Now we are in that count already, aren't we, Garrett? We're already in a bit of a decline, or do we have those days in there that keep?
It's funny. I saw that I saw that question from Trish, and I was like, oh no, I'm gonna have to pull this up really quickly. And I'm looking for my script that I run this. We have been going down, but really the only way to really look at this as far as a consistent downward trend, to be fair, because of reporting, is to look at it with you have to look at it on the 7-day rolling average.
Okay.
Because of things like, when you look at Monday to Tuesday, we will never get to 28-day consistent downward trend just because of by virtue of Monday and Tuesday. They will always break that with Monday and Tuesday. So you have to look out on a rolling average, and I do have that. But I'm trying to find out where I put it right now. So Trish, I'm going to keep looking for it while we're going through this, and hopefully I find it before we're done. If not, I promise I will have it with you tomorrow.
Yeah, I know that that's going to be a question a lot, but yeah, those are the criteria that's come out. Now we're also still waiting for what specific school districts are going to use to measure. We know we'll get asked about that a lot. Yeah, Trishana writes, I've been watching the numbers too, Garrett. It seems to fluctuate still. Yeah, and that's why we always look at those curves that help sort of tell a better story of trends and changes, because if you looked at things day to day and made choices just based on that day, it wouldn't be the safest and truest choice out there, because the curve sort of tells a better story.
Yeah, I mean, you really have to, like I said, you have to look at the curve on that, the 7-day average,
Yeah.
just simply because of reporting delays. It would never, and we've said before, one of the frustrating things with this pandemic is that the actual data doesn't firm up for 2 weeks. So
Yeah.
we look at these day-to-day numbers that the ACDHS puts out, and we use that sort of as a proxy of what's going on. And then, some people will look at the curve and be like, oh, look, it's going down. Well, those as we said, those numbers haven't firmed up yet. So it takes 2 weeks for anything to firm up. So as we're looking at the, when, and especially because it's the daily reported, that's why the moving average is even more important, because of those sort of blips in reporting on, those Monday to Tuesdays where it's always going to jump. So we just have to look, all right, well, we're accounting for Monday being very low, Sunday and Monday, so that, we can see if there is a consistent downward trend.
Katie Murphy asks, how many people in the world have had the virus twice? Katie, I don't think that those specific numbers are out there just yet. As soon as we see specific hard numbers on this, we'll pass this along. But because this is a new virus, and because this is sort of a new situation that's happening, as soon as we see numbers on that, we'll be sure to pass them along to you. But we haven't, Garrett, you haven't seen anything either on this.
No, I've been asked that question also a lot, and there's just nothing going to be in the data that says that right now. So we just don't know. That's something that really we're going to see more in white papers first, in sort of Lancet journals and the journals that talk about these things, before we actually see it in the data.
Yeah, we'll keep tracking that though, Katie, because I know a lot of people are interested in that, and something that's now just starting to be talked about a lot more. Let's see. Somebody just a second ago, let me scroll back and find it, asked, oh, Linda asked, is it safe to live in Arizona? Linda, we certainly hope so. Both Garrett and I are in Arizona right now. I've lived in Arizona since off and on since 1987. It's a wonderful place. I believe that it's safe as long as you take precautions. And right now, we wear masks in Maricopa County when we are out in public. We have bars and health clubs and water parks and movie theaters all shut down, just so that we can kind of get a handle on these numbers and get back into a decent zone where it's safe for people. So we certainly hope so, Linda. And one more statement that just came in. Brant writes, I live in the Midwest now, and the new hotspots are in the Midwest. I like numbers, and my kids live in AZ. I just had to point out this comment from Brant, because Brant, you join us on here most days, I should say, throughout the week. And I'm shocked to hear that you live in the Midwest. So I'm shocked. I would have guessed that you were right here in Arizona all the time, but I see why you have such an interest when your beautiful kids there in the photo live here in Arizona. So thank you for always making time for us, Brant. Let's see. Oh, Andrea asks, did the people under 20 here in Arizona have any underlying medical conditions? We reported on a family who lost someone who was 20, just at 20. And we know his situation, because his family so graciously wanted to share his story to make sure that his memory was honored. And we had their story last night, and they had discovered later that he had an underlying medical condition that they didn't even know about. So we know in that particular case, but Garrett, I don't believe, is there any data tracking that information publicly, unless one of these 12 families who have lost someone under the age of 20 here in Arizona share that personal information with us?
No, especially not in this state. There may be in other places some more breakdowns, but Arizona, our health department has a very strict interpretation of HIPAA, and whether we agree with that or not, it's sort of besides the point on this. They will not share this sort of information. We sort of got that same situation with the DCS. People ask about, oh, do we know anything about COVID cases in DCS, Department of Child Services? And the answer is no, and we probably won't, because they already don't share with us that that much information, especially amongst minors. So I can't imagine DCS or the health department sharing anything in that regards.
Yeah. Tim writes, so sorry for this loss of life. May God bless his soul. I wish ABC 15 would be honest in their headlines and say he had an underlying condition. We were. We just told you now. His family shared that, and we shared that in the story last night at 10 when we honored his memory. So we absolutely share that information, and as long as his family wants to share it, we shared it. So there's no hiding of it. Let's see. Let's see what else. What other questions can we answer? We're almost running out of time. The afternoon goes by so fast. I'm actually here, as I mentioned, on Wednesdays at the station to anchor our 4 p.m. newscast. So this gets a little close to the time I have to go prep and get ready for that. So just a few last questions. Oh, Andrea, got here late. What's the R0 number? It's below 1. It's 0.91. Is that what we said, Garrett?
Yeah, 0.9.
Mm-hmm. 0.9. Let's see. What else?
No, I mean, it was pretty. I mean, the reality is today, it's one of those days where we just have to sort of watch the trends. There wasn't anything that really truly stood out today. This is just a trend watching day. So, we really got to see this backlog cleared. I know that, one of the good things and what might be considered, what's helping out our numbers right now is that ASU saliva tests are reported to the AZDHS within the day, that same time frame. So a lot of these tests that were coming in the last couple, 72 hours are coming from ASU. And we're getting the negatives on that. So, we are getting good information. It's just a waiting game right now until we get those tests processed, and then we can say, we're happy about this or not number.
Yeah. Let's see. Nick writes, what are the death numbers per capita? We can pull up that per capita and get a better look. Nick, this is something we've talked about, especially with the counties, because counties have different size populations. So when you're comparing them, you're not getting as much of an accurate look. It's worth looking at when we say that Maricopa County is in second place across the nation for the sheer number of deaths. But you're right, it's absolutely important to look at per capita, and we can do that as well, right, Garrett?
Yes, we're going to go to 91 DVOC. This is 91-DVOC.com. I'm going to just give me 1 second, just in case.
This is a site that we jump to often.
Yes.
For those of you that are needing to remember it outside of here, it's just COVID-19 spelled backwards. So
yes,
you don't have to necessarily jot it down.
They're put together by a professor that gives us an idea of what the case is and everything look like when compared to other places, states in this case, and gives us a great visualization. I'm going to start with cases. This is all normalized per capita. As you can see, about 17 days ago, 22 days ago, my apologies, Arizona was at the highest number of new cases over a 7-day average, and it was higher, in fact, than even New York. But we have slipped now. Basically, we're now just in sort of the first tier pack at this point, and going down. Some of those other first tier pack numbers are going up. We are going down. So we're sort of going down that number. Let me go to the best number.
Oh, Garrett, I was going to ask you to show us what date was it that we were at that high peak, so people can kind of have a frame of reference.
That was right there, 22 days ago. So that's you're making me do the math in my head, but
Sorry.
it was 22 days ago. Yeah.
No, 22 days ago helps because 3 weeks back it gives us a better understanding of how far we've come and how much our actions change things, how much masking up and being able to close some of these places that where this virus is airborne, and it's showing a change. It's showing that it's helping.
So we're going to look also at we're going to look first at per capita total deaths. This is not with a weekly average. This is literally just a cumulative death number, and you can see that Arizona has been fairly low. It was on the lower tier of the states for quite some time, but it has been increasing since about that 20 to 22 days ago. And again, we can expect that as cases rise, deaths rise about 27 days later. So we've been in an increase because of that lag. So thank you. July 7th was 22 days ago. Thank you, Debbie. So this is total deaths, and then we're going to look at the week per average, and you can see that because of that 27-day lag, with those cases 22 days ago or so, we were at least for this round, we were the highest per capita new deaths in the country for about 7 days ago. We were hitting that. We're now down in again sort of the lower we're in the tier of states, but we're now sort of being on par with other states. I can't read the other place. I think South Carolina and likely no, it's not Florida. It's another state behind us. I can't read it. But
right when you're highlighted, you can't see it.
Yeah, I can't read it, unfortunately. That is Louisiana. So we're basically in the same tier as Louisiana and South Carolina per capita at this point. However, because as we talked about the lag, we also have to expect that this number, this new deaths week average, we've seen it go down. It will likely continue to go down because it should be following the lag that we've been seeing here. So as this is continuing to go down, so should that number.
Yeah. Okay, important stuff. We're running out of time. I just want to get to just a few quick rapid fire questions if we can. Susan's asking, when will he open gyms, meaning Governor Ducey here in Arizona? So Susan, part of the executive order said that they are closed indefinitely, but that every 2 weeks they will sort of assess things. Probably behind the scenes, but every 2 weeks they'll sort of take a look at things. Someone else asked, and by the way, Susan, if you want that entire executive order, I've posted it on my Facebook page, and you can read through and find all the information on there. There's my Facebook page, facebook.com/news from Katie. And by the way, thank you to so many of you who have joined our conversation over there as well. Another quick question, Jeannie Stockton writes, in locations where zip codes straddle 2 counties, how do you decipher that data? For example, 85142 covers houses in Pinal County and Maricopa counties. So Garrett, she would have to pretty much look at both places, look at both the zip code map and then go to the county site. Yeah,
that's definitely difficult for the zip code. I wouldn't look at the zip codes and try to parse them on anything. I mean, when I do anything with the zip codes, I do what's called, I'm going to get kind of geeky here, I do a centroid on those, which means it takes the very center of the zip code, and then I place them in wherever they're supposed to go. I understand, obviously, that is an estimate, because if you're doing a centroid, checking the center of the zip code and saying, okay, it's in Congressional District 5 or whatever, realistically, there could be a very high densely populated area that crosses over another congressional district. So these are estimates. They're the best we have, but there's just really no way to do that. Just look at the zip codes by themselves and not worry about the counties.
Yeah, that's the best advice. Okay, one more question. Horace writes, is Governor Ducey speaking today? We have not heard anything about his plans to speak today. In fact, we don't even hear when he's speaking next, usually until day of.
Yeah.
And that usually happens around 3 o'clock. So as soon as we know, I usually post it on my Facebook page. Garrett tweets it out, things like that. And here at ABC 15, we mention it as well. That's usually the best place to find it. But he has no plans to speak publicly today. Okay, I think that takes us out of time. We've gone longer than normal, and I've got to get ready for the 4 o'clock newscast. As always, Garrett, thank you for your expertise on this and looking into the numbers. Thank you for all of us who've joined us on here, who've asked really thoughtful questions, and we hope that we've helped you better understand the data as it's provided from the state, and then that in turn helps you make the best decisions for your family, in your life, in your health. As always, you can find our very latest information on abc15.com/coronavirus. All of our reporting is there. And you can find me, I just mentioned my Facebook page. I'm also on Twitter at Katie Rammel. Garrett's on Twitter at Garrett_Archer. And we will see you for tonight's newscast. We'll be back here for you to answer more questions, as we always do, tomorrow afternoon. Be safe out there.